Good afternoon. Today, I will talk about the Ebola epidemic, and specifically, what there is to be learned for people who will never get Ebola. But first and foremost, I would like to sincerely thank Deborah Breslow, the Lester Breslow Fellowship Fund, Dr. Mario Molina, and our judges for this tremendous opportunity, which has pushed students like myself to think critically about public health and develop our voices in the field. This is my grandfather. And while I didn't know it when this picture was taken of us, he was actually involved in two important discoveries related to tobacco. The first discovery was one that he made when he was just a young man in the Navy. He realized that men who smoked got smoking breaks, and those who didn't. So he started smoking. The second discovery wasn't one that he made, but unfortunately he played a small part in it. Tobacco has killed more members of the U.S. Armed Forces than all of the wars in our country's history combined. When we think about public health, the tremendous reduction in smoking comes to mind as one of the greatest health victories in recent history. It was just over 50 years ago that the very first Surgeon General's report on smoking was published. When we look around the world, we see a different facet of public health. Last year, Indian Prime Minister Narendra Modi was elected on a platform that included a focus on sanitation. Yes, in 2014, in the world's most populous democracy, one of the most pressing issues was the country's lack of toilets. As these examples illustrate, health is inextricably woven into the fabric of every facet of our lives, from individual choices like smoking to the infrastructure that support a clean and healthy environment. At each of these levels, there are public health professionals working to make health a more salient consideration for decision-making. Last year, the Ebola epidemic had quite a few lessons to teach these public health professionals. Among them was the importance of adequate healthcare workers and facilities, not only in the countries most affected, but also in Europe and the US, in our increasingly globalized world. But for those in the field, and especially for those not in the field of public health, perhaps the greatest lessons came from Ebola's disappearance. While the virus most certainly has not disappeared from West Africa, as this graph from Google Trends indicates, it didn't last very long in the news. The vice president of Sierra Leone just finished a 21-day quarantine after one of his bodyguards died of Ebola, but a Reuters reporter described the mood on the ground as complacent. This is by no means meant as a criticism of anyone involved, but rather should be taken as an illustration of the way that we all experience health crises. In our own backyard, measles has had much the same fate in the spotlight. The concern is that as these stories leave the headlines, they similarly fade from the political agenda and our collective consciousness. Now imagine a plot of your own concern for health as a friend or family member has experienced an illness. I think that for many of us, the graph would hold the same peak and plummet shape. At the peak, the very worst of it, like losing a loved one too soon, we wonder how we ever could have neglected our health. But over time, the peak drops, and we too can become complacent. Today's public health challenges require substantial, long-term investments from all sectors. In public health, we talk about health in all policies as a step in this direction. But the Ebola epidemic and Ebola's disappearance can be taken as a reminder that what we need is health in all people. From Navy veterans and their grandchildren to policymakers and prime ministers, we all have a responsibility to consistently prioritize health and advocate for it within our spheres of influence. After 20 years, my grandfather quit smoking, thanks in large part to the Surgeon General's report. But most importantly, it was thanks to constant support from my grandmother, my aunt, and my father that he quit and I got the time with him that I did. The Ebola epidemic may have felt far away, but its lessons could not have hit closer to home. We all must make a lasting commitment to health. Thank you.